Hello, I'm Dr. Megan Pesh, Assistant Professor of Pediatrics in the Division of Developmental and Behavioral Pediatrics at the University of Michigan Medical School, which is in Ann Arbor, Michigan. Welcome to our podcast entitled CMV Patient Perspectives, One Newborn's Diagnosis. Joining me today is Samantha Neikert, who is a parent, a patient, and a friend. Her daughter was diagnosed with congenital CMV, and she is here to discuss her journey from pregnancy and diagnosis to managing her daughter's condition. Welcome, Samantha.
Hi, thank you for the introduction, and I'm excited to be here today.
Well, I'm thrilled to have you. As a clinician, we hope that listening to Samantha's story will give you an understanding of a family's experience with congenital CMV and give you the confidence to have these conversations with your patients, their parents and caregivers about congenital CMV. Now, Samantha, tell us a little bit about yourself and your family.
Hi, so I am a mom to two girls. I have a toddler who's about 3.5 right now, and Evangeline, but we call her Evie, and she's about 20 months old, and she was born with congenital CMV. She was born with profound hearing loss and has some gross motor delays because of CMV.
Now, Samantha, just to start off, what did you know about CMV or congenital CMV prior to becoming pregnant or during this pregnancy?
So I had heard of CMV before either of my pregnancies, but I had not heard of congenital CMV. About 10 years ago, I worked in an infectious disease research lab, and the lab next door was a virology research lab, and they did some work with herpes viruses. So I participated in one of their blood bank studies, and I distinctly remember sitting in their clinical researcher's office, and he told me that I screened negative for all of the viruses on their panel. And I remember seeing CMV on the list and thinking I had never heard of that one before. And then later on in my career, I learned that, CMV can pose some risks to people who are immunocompromised, like transplant patients. But again, I had never heard of congenital CMV, not until, my daughter ended up testing positive for it after we discovered her hearing loss.
How was your pregnancy? Any red flags? Any abnormalities on ultrasound?
No, my pregnancy with Evie was like remarkably easy, especially compared to like my first pregnancy. There were no complications until I went into preterm labor.
Oh.
So I went into labor with Evie. It was about 35 or 36 weeks, which is early, but not super early, not uncommon. I had a pretty uneventful labor and delivery with her. She had no respiratory concerns, just that she was a little early and she was small. At about 5 pounds.
Did she have any, we think about like petechiae or the blueberry muffin rash or anything that really stood out about her physical exam wise? Like, was there any reason for you to be that worried you when you first saw her in that newborn hospitalization?
So she was low birth weight, but that was because she was early. Even though when I brought her to the pediatrician and she wasn't on the growth curve, it was okay because she was so early. And then like any physical signs, she had like typical newborn jaundice that resolved in a few days. She had a few birthmarks, and that's really all I could see.
Yeah.
So I didn't see any rash.
So when did you get your first inclination that something might be wrong or something might be going on with Evie?
Well, clearly that would be when she failed the newborn hearing screen in the hospital, which they did twice on 2 separate days. So they did it, I think the first time they did it was might have been the night after she was born. I was fully expecting the nurse to come back in and tell me everything was fine.
Right.
Then she said, no, she failed or referred is the technical term on both sides. And she said, we'll try again tomorrow. So I didn't think anything of it. And then the next day they brought her back again. and she failed both sides again the next day, which is when I started to worry.
Okay. And then take me from there to how you found out that Evie had congenital CMV. What happened next?
So after we got home from the hospital, I tried not to worry. And then after that, we went for the follow-up testing. And I remember the audiologist who was doing the test I would say she was very nice, but I would say that she became much more like reserved and less
Mhm.
chatty at some point through the ABR test.
Yeah.
And I remember she sat down and she said, I didn't, or we didn't register any auditory brainstem response. And I
Mhm.
said, well, what does that mean? And,
Right.
she went on to explain that that indicates severe to profound hearing loss, and that she did the additional test to make sure there wasn't, something going on in her ear canal that would be contributing to that. And they sent me to see an ENT, and they ordered some blood and urine testing.
Mhm.
And this was when she was about 4 to 5 weeks old.
Mhm. Okay.
And they said, let's do this blood testing to screen for, I think, 2 of the most common genetic causes.
Mhm.
And then we're also going to screen her for CMV antibodies. So this was the first time I had heard of CMV being brought up in her care.
Mhm.
And then she said, and we'll also collect CMV urine because that will indicate like a more active infection
Mhm. Okay. Yeah.
versus just antibodies, which would reflect like a past infection or a recent infection. And they all came back positive, but then they followed that up with, well, this wasn't done in the first 21 days of life.
Right.
So this would just indicate an infection now or maybe a few weeks post birth, but not a congenital infection. So
Right. So
that
you can't tell the difference at that point. It's like Evie has been exposed to CMV at some time since she was a fetus to now. In terms of the CMV diagnosis, so the urine came back positive, but because she was older than 21 days, couldn't really tell if it was postnatal or congenital. And then we went ahead and ordered the remainder of her dried blood spot. Yeah. So I remember what we did was, because Evie was born in Michigan, they keep the remainder of the dried blood spot, so like the Guthrie card. When the dried blood spot came back positive, you were plugged in immediately to care.
That's right. I mean, but you were the person who linked her to all the care she needed. I really didn't feel like anybody else really had the knowledge to do that.
Mm-hmm.
Um, so I appreciated that you were like, okay, we need to get her to see all these providers to evaluate, how severe her CMV infection was or how severe the effects were for her, because
Mm-hmm.
it's important that people know that hearing loss isn't the only effect that it can have. It's clearly the
Right.
most common, but there's many kids who are very severely affected in many ways. So it's important to know how affected they are, and then knowing what's affected, link them to proper interventions and therapies that will help them move forward.
Mhm. And, one of the things I think is tough about CMV is that, I personally don't think a lot of the professional organizations like the American Academy of Pediatrics have really kept up with CMV. So I think to date, there aren't any published guidelines on treating those kids from the American Academy of Pediatrics. But of course, there's so much more, like ophthalmology and getting them plugged in for developmental monitoring and so forth. But I'm hopeful that some guidelines will come out in the next few years, even for pediatricians and general practitioners who are trying their hardest to do their best for their patients. The information just isn't out there.
That's exactly what I found with,
Mhm.
Evie's doctors. So
Mhm.
I mean, you and her team clearly have a specialization in knowing more about CMV.
What was the biggest challenge of getting her diagnosed with CMV?
I think in the beginning it was just the lack of answers.
Mm-hmm.
You always, as a parent, you clearly don't want something like this to happen. And for it to happen like right when they're born and right in that immediate postpartum period it's a lot, because that's a time period that's already pretty challenging just with general newborn challenges like the lack
Yeah.
of sleep, and I had a toddler at home too. So I mean it was pretty overwhelming, and I'm someone who finds solace in information, and I felt
Mm-hmm.
like I didn't have really any information. Then, there's all these other potential effects from CMV, like an intellectual disability, cognitive concerns, motor concerns.
Mm-hmm.
And then, of course, the more severe implications. So I think to move forward in that regard, we've just had to take one step at a time. We have to fit a lot of appointments and therapies into every week, which is a challenge in and of itself.
Looking back, even before you were pregnant, like when you were thinking about becoming pregnant, would you have liked to have known at that point whether or not you'd ever been exposed to CMV? People will talk about looking at serologies for CMV, so IgG or IgM status. What are your thoughts on that?
Well, I mean, I kind of did know that I hadn't been exposed to CMV from that herpes blood bank study that I
Well,
did.
wasn't that like 10 years before?
Should they have done like an updated, just like with my regular prenatal labs?
Well,
I
I
mean,
don't.
sure. I think more
Mhm.
information is powerful.
Mhm.
I know that you can have like a CMV reinfection or which is, so I think if someone's positive for the antibodies, I guess there's still a risk. But I think it would have been helpful to know. And I think definitely a conversation about CMV would have been the most beneficial. Um, I've been told that the most likely source of my infection was probably from my toddler. Um,
Mhm.
so I think it should be probably emphasized with parents who have other children at home, because they're such frequent sources of the infection.
Exactly. And so what do you wish, I guess, your providers would have talked to you about? Like, I know there are some risk reduction behaviors, and it's because toddlers, especially those that are in daycare, um, we all know it's like a petri dish at daycare, and they just pass around everything. But in terms of CMV, um, it is transmitted through bodily fluids and most often through the saliva or urine of toddlers. So they get the infection, and months after the symptoms have resolved, they're still shedding virus. So yeah. So what do you wish you would have known? In hindsight.
I wish I would have known that my toddler could potentially be shedding CMV in her urine and saliva. And so I needed to take extra precautions when changing her diapers, or handling her pacifiers, or with her food and drinks and utensils. There's some pretty simple preventative things that I or any mom could have done. Um, I would have been, probably more diligent about hand washing after changing her diaper. Um, just really simple things. They're all really easy to forget, especially when you're busy and you don't know that there can be a really significant consequence.
What tips would you give clinicians about talking to parents with newborns who were recently diagnosed with CMV? What would you like the parents to know?
Mhm. I think you tell them what you know and what the possible effects are, and what they need to do moving forward to carefully monitor their child. Um, I think the only thing I really expect from providers is that they listen to my concerns. So I think reaching out to like maybe a larger academic institution to try and find your local CMV expert and loop that person into the child's care would be the most beneficial thing for the family.
Yeah, absolutely. Yeah, I really like that. I think it's so important to listen to parents, and which can be hard. It can be, I think, intimidating when a baby, presents to your clinic with a condition that you're not super comfortable managing. So, Samantha, right now, who is on Evie's healthcare team?
So there's you, there's her, regular pediatrician. Obviously, she has an ear, nose, and throat doctor. Um, she has two physical therapists, one through early intervention. That's the same with her speech therapy too. So she goes and gets specialized therapy called auditory verbal therapy. And
Mhm.
she also has a therapist through early intervention. And then she gets regular follow-ups with ophthalmology, physical medicine.
It's a big team. What has the team handled well in terms of Evie's care?
Once she had this team put together, I think for the most part, it's been really smooth sailing. And everyone has Evie and that's the primary focus.
Yeah.
I think what they've handled well is the general coordination. Once the team was linked and established, it's been really good and much easier um, for myself and the rest of my family.
After you found out that Evie had congenital CMV, around that 3-month mark, were there any surprises?
I think for me, the biggest surprise is just the lack of knowledge, um, both among women and within the medical community itself.
Hmm.
There's plenty of like rare diseases that the general public might not have heard of or know much about. But it's pretty shocking to me how little even general pediatricians or obstetricians know about congenital CMV, and the lack of education to parents and pregnant women is very shocking to me.
And any advice or you would give to, say, a parent of a child who is newly diagnosed with congenital CMV?
The first year is really difficult. There's a lot of workup and a lot of evaluations and a lot of appointments. But over time, it does start to get better. And you will start to see progress with a lot of hard work. So it gets better.
It gets better. Yeah. So a message of hope. Yeah. I think, knowing about how the virus can affect a fetus in utero, it is just incredible how well most of these kids do. It's really just remarkable. Well, Samantha, thank you so much for being here. It was great to catch up, and thank you for this great discussion. I really appreciate it.
You're welcome. It was my pleasure.